There are some residencies where everything just comes together. The people, the commitment to education, the patients, and the location. We have two academic training sites, Lutheran General Hospital and Christ Medical Center. Both are large 800-bed hospitals. Each has a level 1 trauma center. All of our hospitals care for a very diverse group of patients, including those from underserved areas. This gives our surgical residents an unparalleled experience.
We are a tertiary and quaternary care center. We're receiving complex patients from all over the region. We have operating rooms available 24/7 to care for these patients. We have a surgical intensive care unit that is staffed 24/7. That enables us to provide a standard of care comparable to any institution in the country.
Part of what drew me to Advocate Christ Medical Center is the commitment to education within a private practice or hybrid practice model. It's very unique in that we provide tertiary and quaternary level care and also have multiple training programs of our own, as well as medical students, residents, and even fellows who rotate through our surgical and non-surgical services.
Having done my residency and worked at Christ Hospital, it's a high volume, high acuity hospital. You get exposed to a wide range of general surgery pathology, as well as good subspecialty practice.
It's amazing for the number of cases you get to do, the pathology, the attendings who help you. It's because this place really has a long tradition in training.
Each of the faculty members really tries to inspire the residents to achieve the level of skills that they're capable of achieving. The residents become a very integral member of the healthcare team and work with us side by side through even the most complex of cases.
Our residency is fairly unique in that we don't have layers of fellows between the resident and the attendings. So residents in our program have a hands-on technical experience.
So ENT, chest, plastics, breast, there are no fellowships. So you get to work directly with an attending every day.
Gradually, you're exposed more into the operating room. You're given more responsibility. You're guided through kind of the beginning steps of the operation, and then as they become more comfortable with how you're progressing, you're able to give more complex parts of the operation.
They're involved in a very complex and advanced and consolidated program. This makes this program really appealing, mainly because we have really frequently big procedure approach in a minimally invasive robotic technique.
You're in one of the largest cities in the United States, Chicago, with over 8 million people, with a tremendous diversity.
So not only different cultural backgrounds, different life experiences, but also a wide breadth of pathology. We are able to provide excellent care for an underserved population. And so to be able to provide care to patients that may have barriers to care in the past, I think is very, very important.
Within the Advocate Aurora system, we have a long history of research, and I think very importantly, looking at disparities of care, social determinants of health, and population health, and the way all of those interact together to affect individual patient access to surgical care and outcomes.
Chicago's an unparalleled environment for living and enjoying yourself when not in the hospital.
It's an awesome city. There's different neighborhoods. If you're a foodie, it is a phenomenal place.
Chicago is a very nice city, apart from the winter that is very is sadly famous around.
Chicago's a great city. It's got all the opportunities of a large city, but it's got a smaller city feel. It's not as high pressured or rush as a lot of the other larger cities, but it's got pretty much everything that you could ask for.
I can't really picture myself living anywhere else. I love having, all of those relaxing resources at my disposal.
The Advocate Surgical Residency offers you the most comprehensive training in an environment where you experience complex patient care, where you're mentored by experts in surgical education, and a place where you can grow as a young professional to develop confidence, competence, and leadership skills.